Hi, my name is Candy Encarnacion, and I am going to continue reading Professional English News, chapters 5 to 13. In this video, I am going to be reading the chapters left, which are from chapter 9 to chapter 13. Chapter 9, the topic is hospitals. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron, Dr. Barron. The Royal Infirmary is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the sign. Of course, there are many others, for example, the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, HDU. Jordi, what does outpatient mean? Dr. Barron. Outpatients are the people who come to hospital to attend a clinic or to have tests or treatment, and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient's treatment requires only one day, such as a simple operation, they can be admitted to the day surgery unit. Outpatients. Dr. Barron again. The Accident and Emergency Department, A&E, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatients. Dr. Barron again. The inpatients in a hospital are admitted in one of the three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspected myocardial infarction, or they are seen in the A&E department where the doctor on duty arranges the admission. This would happen in the case of a patient with a fractured neck or femur, for example. Larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordy asks, assessed? Dr. Barron answers, yes. Decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Chapter 10, Primary Care. The National Health Service. The National Health Service, NHS, is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as a cervical collar, with exemptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20. Practices are based in a surgery and look after the health of from 1,000 to 50,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinics, give vaccinations, for example, for influenza, and may perform minor surgery, such as a removal of warts and moles. If a patient needs specialist care, the GP will make a referral letter, refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, which means they are unable to leave their homes or too ill to attend surgery. Out of hours treatment (OOH) from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of GPs and locum GPs to cover if someone is absent. Note: the noun surgery has three meanings. Number one, the building where GPs work. The practice has moved to a new surgery on the high street. Number two, a time when GPs see patients. Example, morning surgery is from 8:30 to 12:30. Number three, the work of surgeons. The patient needs urgent surgery on a burst appendix. The practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other healthcare providers, and for filing and scanning documents into patient records. The practice manager has responsibility for finance and sometimes for IT, supervises reception staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients, to change dressings, such as ulcer dressings. Health visitors visit families to carry out checkups on young children, particularly under fives, to make sure they're healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment but also teach patients exercises they can do to improve their condition after an accident or operation. A GP stay. Dr. Stewart works in a practice in a small market town with three other family doctors. The surgery is in the center of the town and is shared by three practices. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. 8 a.m. Arrive at the surgery, check the OOH email printout, check for urgent and non-urgent messages. 8:30 a.m. Check emails from the health board and partners prepare for surgery. 8:30 to 10:50 a.m. Morning surgery, 10-minute appointments. 6 pre-booked last week, 2 booked 48 hours ahead, 4 bookable on the day. 10:50 to 10:52 a.m. Check with reception for messages, sign prescriptions and deal with repeat prescriptions. 11 to 11:20 a.m. Coffee break in the conference room with colleagues. 11:20 to 11:30 check home visit request and divide up visits with colleagues. 11:30 a.m. to 1 p.m. home visits. Chapter 11: Medical Education Part 1. Medical Education in the UK. Medical education in the UK covers undergraduate education, 4 or 5 years at medical school, the section of a university responsible for medical education. Number two, a 2 year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GPs or consultants, often delivered through colleges for different specialties, for example, the Royal College of Physicians. Continuing professional development in the form of courses and seminars, which doctors undertake throughout their working lives to keep up to date. Exhibit B. Extract from an undergraduate prospectus. The MBCHB, Bachelor of Medicine, Bachelor of Surgery, is a 5 year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, an integrated program of clinical and scientific topics, mainly presented through problem based learning (PBL), where you work with others on a series of case problems. Vocational studies and clinical skills. This component prepared you for the clinical skills required for contact with patients from year 1 of your course through periods of practical training where you are attached to a hospital department or general practice. Student selected modules. Student selected modules allow you to choose from a menu of subjects such as sports medicine or even study a language as preparation for an overseas elective in a hospital attachment of your own choice between years 4 and 5. Clinical attachments, years 4 and 5. A series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics and gynecology, and general practice. As students view, Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved with patients from the very beginning. Even in our first year, we spend time in hospitals. Much of the course is PBL. We have two-hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lecturers from 9 to 5. But now it's mainly group work, although we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cut up cadavers from the second month of the course. Chapter 12, Medical Education Part 2. The Foundation Program. The Foundation Program is a 2-year training program which forms the bridge between university level study at medical school and specialist or general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as a trainee, to sample different specialties, for example, pediatrics. A Year 1 trainee (FY1) corresponds to Pre-Registration House Officer (PRHO) post, and a Year 2 trainee to FY2 to a Senior House Officer (SHO) posts. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competencies, which are assessed through observation in their workplace. People in medical education. Tutor is an academic or, in some cases, a postgraduate student who leads tutorials. Demonstrator. In anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturer or senior lecturer, an academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor, a senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. Clinical trainer, a consultant assigned to a trainee who provides training during periods of direct clinical care. Educational supervisor, a consultant who supervises a trainee's period of training. Medical qualifications: BMSc, BMed-Sci, Bachelor of Medical Sciences, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MB-CHB, MBBS, BMBCH, BMBS. Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree of UK doctors. MD or a DM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP, MRCS, member of the Royal College of Physicians or member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in their college. FRCS, FRCS-ED, FRCS Glass, FRCSI, Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow, for example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examinations must be passed. For other colleges, it is by nomination of work assessment. Lastly, Chapter 13, the Overseas Doctor. Types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council (GMC). There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limited Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training, CCT. The GP register is a register of all of those eligible to work in general practice in the NHS. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. PLAB stations and advice. OSCEs assess these skills. Clinical examination. Your ability to carry out a physical examination of a simulated patient. An actor trained to play this role will be assessed. Uncomfortable or intimate examinations will be carried out using a mannequin, an anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient or in some cases the examiner will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make a recent diagnosis will be assessed. Advice on the station from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Keep in mind safety precautions like throwing the sharps in the sharps bin. Don't forget the ABC airways breathing circulation protocol in every emergency station. Check the patient on Check the patient understands what is happening, then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actor says. Note: Sharps are needles and blades which must be disposed of safely in a special container called a sharp bin. That is all. Thank you.